The Ministry of Health says it is difficult to determine whether any deaths were caused by the oxygen shortage at the island's public hospitals at the end of August. That announcement was made at a press briefing last evening. Shamela Pullen reports.
The impact of the oxygen shortage last month is still being assessed, particularly as it relates to COVID deaths. The Health Ministry says from August 1 to September 8, there were 465 deaths with another 109 under investigation. However, Chief Medical Officer Dr. Jacqueline Bisesa-McKenzie says the deaths which occurred on August 27 and 28 at the heights of the oxygen shortage are being investigated.
During the period when some hospitals were affected by reduced oxygen supplies, the public can be assured that all measures were put in place by the management teams to provide support to our patients. The pathology of severe COVID, however, is such that most deaths are going to result from respiratory failure or multi-organ involvement, and hence it will be difficult to say that a cause of death was due to reduced oxygen supplies.
The CMO says the death increase corresponds with a rise in the number of COVID-19 cases.
And as the number of cases increase, the number of persons in hospital increases, the number of severe illnesses increases, and the number of severe outcomes increase. So certainly for this surge, which we hope we are at the peak at, or maybe have just passed the peak, then we would have seen that we have a higher number of deaths just because of the number of cases that we are seeing.
Meanwhile, Dr. Bisesa-McKenzie says the lockdown periods are bearing fruit. She says the reproductive and positivity rates are both trending downward.
It's still early days because we're just seeing the bend going down. And it means that we may have to continue with some of these restrictions that we have in place in order to keep that reproductive rate down and pretty much get it below 1. We want to get it back down to 0.7 and even below. 0.7 was where we were in July, and 0.3 was where we were at last year, July. So we want to get it back to down those levels. That would certainly indicate that the level of exposure in country is reduced, and that will certainly result in a reduction in our numbers.
Health Minister Dr. Christopher Tufton says this is a good sign for the country. He says the ministry is now focusing on expanding the locations for vaccinations.
The bottlenecks that we saw over the past few weeks was a result of some fear, primarily, where persons saw the deaths, saw the overcrowded hospitals, and many panicked, and that was a response. A positive response, nevertheless, but it created bottlenecks because you did not plan for it, because many did not register.
Shamela Pullen, TVJ News.